Welcome to the Norris Cotton Cancer Center's Breast Oncology Program at Dartmouth. I'm Dr. Dale Collins, Medical Director of the program. Each time I present a patient with a difficult choice, I think to myself, what would I do? Even knowing all that I know about treating breast cancer, these choices would still be difficult. My colleagues and I have created a process that ensures every woman newly diagnosed with breast cancer has a clear understanding of their treatment options before making her choice. We did this for 3 reasons. Healthcare professionals have a responsibility to evaluate patients for and inform them about increasingly complicated treatment options. At the same time, the pressures for increased clinical efficiency are driving shorter and shorter patient-doctor interactions. Lastly, we know that the distress associated with a new diagnosis may make it difficult for a patient to understand her options. The Breast Oncology Program and Dartmouth Center for Shared Decision-Making have created a process to help our patients deal with the difficult decisions they will face throughout their journey with breast cancer. Our goal is to help women understand that they have choices and that their individual values and life choices play an important role in the decisions surrounding their treatments. Making these treatment decisions with their providers helps to ensure that women will make choices they will be happy with in the end.
You're here today to learn about the biopsy results from your recent biopsy.
The patient's journey through our process usually begins when a radiologist tells a patient of her diagnosis. Since our medical center covers a large geographic area, biopsy patients are offered a choice of either coming back to the center to receive their diagnosis or to receive it by phone.
I have a patient I need to get in.
Breast program coordinators then carefully arrange the next steps. These usually include a breast MRI, an appointment in the Center for Shared Decision-Making, an appointment to meet with a breast cancer surgeon, and, if indicated, an appointment to meet with a plastic surgeon to discuss immediate reconstruction options.
And today what we're going to do is talk about your upcoming
A breast care coordinator, who is a trained oncology social worker, contacts patients to explain the upcoming appointments. She also gives our patients a bag of educational resources, including a breast cancer treatment handbook, flyers on local resources, and other information the patient might request. Patients are scheduled to go to the Center for Shared Decision-Making before their visit with the surgeon. The center offers video and booklet decision aids developed by the Foundation for Informed Medical Decision-Making. These help patients understand their treatment choices and make it clear that a woman's personal values and preferences are an important factor in making the decision.
And if it's a yes or no question, you're just going to tap on the screen. It will automatically go to the next screen for you.
While visiting the Center for Shared Decision-Making, the patient completes a questionnaire on a touchscreen computer that gathers information about her medical and family history and identifies emotional concerns, including symptoms of distress, depression, and anxiety. The patient is also asked questions about her understanding of important facts related to the treatment choices. She will be asked about her unique preferences and values that may affect her choice, things like appearance, how she feels about losing her breast, and other possible outcomes of treatment. If a patient reports significant symptoms of distress, the computer triggers an automatic, instant email to our breast care coordinators. This allows the coordinators to provide personalized support. In the same way, if the patient identifies a positive family history of risk factors, an email is automatically sent to the genetic counselor, and the patient is given information about the familial cancer program. She can contact them if she wishes to pursue genetic counseling and possibly genetic testing. Using the information gathered in the questionnaire, the computer generates a report. Later, the patient will take this to the appointment with the surgeon. This report is a 1-page summary of the self-reported medical and family histories with comments on mental health and social functioning. The report also displays which treatment option the patient is leaning toward, as well as her responses on the knowledge and values screening. The patient watches a video that describes the surgical procedures the patient may be offered, including mastectomy, with or without reconstruction, or lumpectomy and radiation. It features interviews with women who've been through these treatments, talking about how they reached their decision and how they now feel about those choices. This video helps prepare the patient for the discussion with the surgeon. While the patient is visiting the center, she will meet again with the breast care coordinator, who will now know if the patient has identified emotional concerns on her questionnaire. The coordinator will also introduce the patient and her family members to the supportive programs and services for breast cancer patients.
Okay. Because what it
Throughout
does
the
show is
treatment
that you
journey,
have,
the coordinator will be available to the patient and her family.
Hi, Naomi. Joanne Frampton, nurse coordinator for the breast program. How are you doing? Okay.
The patient will meet with the breast program's nurse coordinator, who will be her contact person for clinical issues and questions. The patient then proceeds to the breast clinic to meet with her surgeon. During the surgical consultation, the surgeon will conduct an examination and discuss surgical treatment options with the patient. Because the patient has just seen the video about the treatment options, the surgeon can concentrate on answering the patient's specific questions and helping her make the right choice for her. Most patients feel ready to make a decision about their surgery during this appointment or shortly after seeing the surgeon. Is there one? Some patients may also want to meet with a plastic surgeon to talk about breast reconstruction. The Center for Shared Decision-Making has another video that covers the treatment options for breast reconstruction. Again, we've found that giving the patient this information ahead of time helps improve the quality of the conversation they have with the surgeon. When the patients come to the appointments with a clear understanding of their options, they can use the appointment time to come to a decision that is in line with their personal values and lifestyle. Because we work together as a team, our program is able to support patients and their families, both medically and emotionally, through this difficult journey. Building shared decision-making into the process ensures that each patient, together with her physician, has thoughtfully considered the treatment options and reached a decision that is consistent with her values, a decision that she feels confident is right for her.